Hello, I'm Dr. Yumi Tanaka. Today, I need to share something urgent with you that could potentially save your life or the life of someone you love. What I'm about to reveal challenges everything you think you know about diabetes testing, and it's information that, unfortunately, many doctors aren't sharing with their patients. Right now, millions of people over 50 are walking around believing they're pre-diabetic or diabetic based on a single blood test result. But here's the shocking truth. That test result might be completely wrong. In fact, recent scientific research has revealed a massive flaw in the most commonly used diabetes tests that's causing healthy people to be misdiagnosed and unnecessarily prescribed medications they don't need. This isn't just a minor medical oversight. It's a systemic problem that's affecting millions of people worldwide. If you've ever had an HbA1c test come back higher than expected, especially if you eat a healthy diet and maintain good lifestyle habits, you need to watch this entire video. What I'm about to explain could change everything you think you know about your health status and potentially save you from years of unnecessary worry and medication. Let me start with a real scenario that's happening right now in doctors' offices across America. A 55-year-old patient walks in for their annual checkup. They exercise regularly, eat a balanced diet, maintain a healthy weight, and feel great. But when their blood work comes back, their doctor delivers shocking news. Your HbA1c is 5.8%. We need to start monitoring this closely and consider medication. This patient is confused and devastated. How could they be pre-diabetic when they're doing everything right? They start restricting their diet even more, increase their exercise, and live in constant fear that they're developing diabetes. But here's the truth that will shock you. This person might not be pre-diabetic at all. The problem lies in how we interpret HbA1c results. Most doctors and patients believe that HbA1c reflects your average blood sugar over the past 2 to 3 months. While this is partially true, it's an oversimplified explanation that's leading to massive The real science behind HbA1c is far more complex, and when you understand it, everything changes. Let me explain exactly what HbA1c actually measures, because this understanding is crucial for interpreting your results correctly. HbA1c doesn't directly measure your blood sugar levels. Instead, it measures the percentage of your hemoglobin that has been Now, let me break this down in simple terms. Glycation is a process where sugar molecules in your blood attach to proteins in your cells, including the hemoglobin in your red blood cells. When this happens, it creates what scientists call advanced glycation end products, or AGEs, which essentially means your proteins become damaged by sugar. The more sugar you have in your blood over time, the more glycation occurs. Hemoglobin is the protein in your red blood cells that carries oxygen throughout your body. So when we measure HbA1c, we're actually measuring what percentage of your hemoglobin has been damaged by sugar. An HbA1c of 5.8% means that 5.8% of your hemoglobin is. Now, here's where it gets interesting and where the traditional interpretation starts to fall apart. The amount of glycation that occurs depends on 2 critical factors. First, how much sugar is in your blood, and second, how long your red blood cells live. This second factor is what most doctors and patients completely ignore, and it's causing massive Here's the revolutionary discovery that's changing everything we know about diabetes testing. Recent scientific studies have revealed that red blood cell lifespan varies dramatically from person to person. While the average lifespan is considered to be around 120 days, some people's red blood cells live as little as 80 days, while others live as long as 150 days or more. Why does this matter? If your red blood cells live longer, they have more time to become glycated, even if your blood sugar levels are perfectly normal. This means your HbA1c will appear artificially high, making you seem pre-diabetic or diabetic when you're actually completely healthy. Let me give you a concrete example. Imagine 2 people with identical blood sugar levels throughout the day. Person A has red blood cells that live 90 days, while person B has red blood cells that live 130 days. Person A will have an HbA1c of around 5.2%, which is considered perfectly normal, but person B will have an HbA1c of 5.9%, which is considered pre-diabetic, even though their blood sugar levels are identical to person A. This isn't theoretical. This is happening right now to millions of people. The healthier you are, the longer your red blood cells tend to live, And paradoxically, the higher your HbA1c might appear, even with normal blood sugar levels. Before I continue with this crucial information, if you're finding this valuable and want to learn more evidence-based strategies for healthy aging, please hit the subscribe button and ring the notification bell. We publish new scientifically backed content regularly that could help you live a longer, healthier life. Your subscription helps us reach more people with this important information. So what causes red blood cells to live longer? This is where it gets really interesting, especially for people over 50 who are focused on healthy aging. There are several key factors that increase red blood cell lifespan, and ironically, they're all markers of good health. First, low oxidative stress and inflammation. When your body has less inflammation, your red blood cells aren't under constant attack and can live much longer. This is why people who eat anti-inflammatory diets, exercise regularly, and manage stress effectively often have longer living red blood cells. Second, stable blood sugar levels. When your blood sugar is constantly spiking and crashing, it creates glycation damage that actually kills your red blood cells faster. People with stable, healthy blood sugar levels have red blood cells that live significantly longer. Third, strong cell membranes. Your red blood cells need strong, flexible membranes to survive the constant circulation through your body. Nutrients like omega-3 fatty acids and cholesterol are essential for membrane health. In fact, cholesterol makes up 50% of your cell membranes by weight. Fourth, optimal nutrition. When your body has all the nutrients it needs, including B vitamins, iron, folate, and vitamin B12, your red blood cells are healthier and live longer. Here's the irony. If you're doing everything right for your health, eating well, exercising, managing stress, maintaining stable blood sugar, your red blood cells will live longer, and your HbA1c might appear higher than someone who's actually less healthy than you. This isn't just theory, it's backed by solid scientific research. A landmark study published in a peer-reviewed medical journal examined the red blood cell lifespans of over 130 participants and found dramatic variations. Some participants had red blood cells that lived only 80 days, while others had cells that lived over 140 days. When researchers adjusted the HbA1c results based on actual red blood cell lifespan, they found clinically significant differences. People who appeared to be pre-diabetic based on standard HbA1c interpretation actually had completely normal glucose metabolism. When the test was properly adjusted, multiple follow-up studies have confirmed these findings. The conclusion is clear. Standard HbA1c interpretation can be misleading, especially for healthy individuals with long-living red blood cells. So, how can you know if your HbA1c results are accurate? The gold standard is to monitor your actual blood glucose levels throughout the day using a continuous glucose monitor. If you're truly pre-diabetic, you'll see elevated blood sugar levels consistently throughout the day, especially after meals. However, if your HbA1c is elevated but your blood glucose levels remain stable and normal throughout the day, it's likely that your elevated HbA1c is due to longer red blood cell lifespan, not diabetes. Another important test is fasting glucose. True diabetes is defined as prolonged elevated blood sugar levels. If your fasting glucose is consistently under 100 milligrams, you cannot be considered diabetic, regardless of what your HbA1c says. You can also look at other markers of metabolic health, including your triglyceride to HDL ratio, your insulin levels, and your overall inflammatory markers. Healthy individuals typically have excellent numbers across all these markers, even if their HbA1c appears slightly elevated. What does this mean for you practically? First, don't panic if your HbA1c is slightly elevated, especially if all your other health markers are excellent. Look at the complete picture of your metabolic health, not just one test. Second, if you're concerned about your HbA1c results, ask your doctor about monitoring your actual blood glucose levels for a week to get a true picture of your glucose metabolism. Third, continue focusing on the fundamentals of metabolic health. Eating nutrient-dense whole foods, exercising regularly, managing stress, getting quality sleep, and maintaining a healthy weight. These factors will improve your actual health, regardless of what any single test shows. The bottom line is this: HbA1c is a useful tool, but it's not perfect, and it shouldn't be used in isolation to diagnose diabetes, especially in healthy individuals. The healthier you are, the more likely your HbA1c might appear artificially elevated due to longer red blood cell lifespan. True diabetes is defined by consistently elevated blood sugar levels, not by a single HbA1c reading. If you're living a healthy lifestyle and your other metabolic markers are excellent, don't let a slightly elevated HbA1c cause your necessary worry or lead you to make drastic changes to an already healthy lifestyle. Remember, the goal isn't to have perfect lab numbers. It's to be genuinely healthy. Focus on the fundamentals, monitor your actual glucose levels if you're concerned, and work with a knowledgeable healthcare provider who understands these nuances. If this information was helpful, please give this video a thumbs up, subscribe to Longevity Lab for more evidence-based health content, and share this video with anyone who might benefit from this crucial information. Your support helps us continue providing scientifically accurate health information that can truly make a difference in people's lives. Until next time, this is Dr. Yumi Tanaka reminding you that knowledge is power when it comes to your health. Stay informed, stay healthy, and I'll see you in the next video.